Thank you so much for coming. I'm Dr. Alveda King, Director of African American Outreach for Priest for Life and founder of King for America. We're here today while Congress is on break because we as African American leaders and pro-life warriors could not take a break while America is in such desperate need of health care. We support health care for all Americans. Indeed, we want to make sure that they have the best, that each of us has the best health care possible. And that includes our tiniest, our weakest, our infirm, and our elderly. And so therefore, you will hear from several of us today, not raising argumentative voices, but raising voices of hope. My uncle, Dr. Martin Luther King Jr., once said that he had a dream that all Americans would serve the beloved community. He said that he wanted Protestants and Catholics and Gentiles and Jews to join together in the age-old spiritual free at last. So we're here today to invite Republicans and Democrats alike to join the choir. Let's serve America from the youngest to the most mature with good health care. We have some speakers who are going to speak to you briefly today, because we thank you for coming and we know that your time is very important. And so we have Dr. Donna Harrison, Mrs. Day Gardner, and Pastor Dean Nelson. And they will each come to you first, Dr. Harrison, and then Day Gardner and Pastor Nelson, and I will come back to you. And then we believe we will be joined by Bishop Harry Jackson. We are a group of people who have different political persuasions, different vocations, different ethnic groups, but we all care about the health care of America. Again, thank you for coming.
Thank you very much. I'm Dr. Donna Harrison. I'm the president of the American Association of ProLife Obstetricians and Gynecologists. We're one of the largest special interest groups within the American College of Obstetrics and Gynecology. And I'm here to talk with you about Hippocratic medicine, that is medicine according to the Hippocratic Oath, and how that is involved with the healthcare debate that the nation is undergoing right now. The Hippocratic Oath that I take as a doctor means I won't kill you, and I won't kill your unborn baby, and I won't kill your grandma. When I as a doctor take that Hippocratic Oath, I vow to protect and not to destroy human life. But as an OB-GYN doctor under the proposed health care bill, I could lose my job for refusing to kill your unborn child. The doctor who vows not to harm you or your child is protected by 3 narrow laws, all of which could be wiped out under the proposed health care reform. The American Association of Pro-Life Obstetricians and Gynecologists joins in calling on President Obama to keep his promise to protect the right of conscience of all health professionals, not just doctors, but nurses, midwives, pharmacists, and PAs, all of who have vowed not to hurt you or your unborn child or any of your family. We call on the President to change the proposed healthcare reform bills to explicitly include real and not deceptive conscience protections for all healthcare professionals who work to protect and not to destroy human life. Abortion destroys life. Abortion not only kills the unborn child, but also increases the mother's risks of suicide, depression, substance abuse, and other adverse mental health outcomes. Abortion increases her risk of preterm birth and cerebral palsy in the next pregnancy. RU46 abortion increases her risk of death from infection and massive hemorrhage. These and other health risks are well documented in the medical literature. Abortion destroys life, and abortion in this country is targeted at black women. 1/3 of the abortions done in this country are done on black women, even though black women make up about 1/6 of the population. Under the current bill, tax money is used to fund abortion providers who already expand operations disproportionately to black Americans. This means more black children aborted. We call on President Obama to explicitly exclude any tax funding of abortion from any proposed healthcare reform bills, even guised under the terms of reproductive health. And we call on the President to stop all current government subsidy to those organizations who, in their roots and in their actions, target the black community for genocide. Healthcare is about life, and healthcare reform must be about making life better for all people, not destroying the lives of people who someone else doesn't want. Thank you.
Hello, and I would like to thank you also for joining us today. And I want to join Dr. King also in thanking our honorary sponsors, Congressman from Arizona, Trent Franks, and also the Congressman from Louisiana, Congressman Gao. So thank you for being our honorary sponsors. I am the president of the National Black Pro-Life Union. And in a time when America is spiraling down into an abyss of debt, joblessness, and economic turmoil, President Barack Obama has been putting a great deal of his time into a big push to kill as many children as possible. In less than 9 months, he has overturned the Mexico City policy, which means American tax dollars will be used to pay for foreign abortions. He has also been working tirelessly to force physicians to either kill unwanted children or refer their patients to other baby killers. He has also worked to ensure that even more children are killed by removing the ban from embryonic stem cell experiments. Since 1973, when Roe v. Wade was decided, abortion has killed more than 50 million of America's children. 17 million of them were black. Today, for every black baby born, another black baby is killed by abortion. Planned Parenthood is the nation's largest abortion chain. It has planted its clinics strategically in our urban and minority areas. This is no accident. The Alan Guttmacher Institute and the Center for Disease Control Prevention show that a huge majority, more than 75%, of abortion clinics are located in minority neighborhoods. Abortion has become the #1 killer of black people in this country, killing more African Americans than accidents, heart disease, stroke, crimes, HIV, AIDS, and all other deaths combined. We must realize that abortion is big business in America. Planned Parenthood raked in $1 billion last year, including more than $350 million from you and from me, the American taxpayer. Just think about that. Last year, thousands of Americans lost their homes due to foreclosed loans, many of which could have been saved with $350 million. We have men, women, and children, entire families living on the street. I've seen them, you've seen them. Fellow Americans, destitute and homeless, and $350 million could have provided housing and shelter for many of them. Many of our schools, especially inner city schools, are in shambles. $350 million could have paid for more teachers, books, and computers. President Obama's most recent effort to push a health care bill that will mandate taxpayer-funded abortions is next. Let's not mince words here. Abortion is no picnic. It's a horrible and gruesome procedure that kills babies by suffocation, decapitation, and dismemberment. In spite of all this, the president is relentless in his determination to continue his support to the abortion industry, and he wants to force you and me to pay for it. That's unbelievable. Why would anyone be so bent on helping to grow industries that include the gruesome and vile butchering and dismembering of helpless human beings? We must all come to realize that if we are truly the America that holds life, liberty, and the pursuit of happiness so dear, then we must obliterate the scourge of abortion from our midst. Otherwise, we are no better than those who perpetrate the conflict in Darfur, Rwanda, or any other country where human beings are enslaved, butchered, or denied their rights just because they are meeker or weaker. I'm here to say, no, Mr. President. Abortion is not health care, but rather death care, and I don't want to pay for it. It's that simple.